First of all, I would like to thank Ms. Maria for giving me an opportunity to present in this conference. My topic is non-linear error function based extended Kalman filter with scaling factors for cancer chemotherapy terms. Here, the cancer is nothing but the abnormal cells which divide without control and is able to invade our tissue. And right now, so many cases we are going to find it out. In 2040, the cases will going to rise from 19.3 approximately to 28 to 30 millions in 2040, and that is the major issue that was declared by Cancer Global Observatory Cells, and the mutations and the development of these are lifetime basis. That's why globally it was just find it out of 6 one death was caused due to cancer. The survey it was done in such a way that when chemo is given now to treat the cancer, there are so many treatments are there, likewise surgery, radiations, chemotherapy, pathology, radiology, nutrition, all these theories are there. I have focused on the chemotherapy as I am relating towards the mathematical modeling of the chemotherapy doses which is instructed to the particular patient. The possibility of the side effects which I have found it out, that is flashing in front of you, the possibilities of the side effects are the nauseas, vomiting, diarrhea, constipations, mouth sores are there, neuropathies are there, blood clots, hair loss, and so many things are there. These are the side effects of the chemo which is given to the particular patient. If the amount of drug dose is increased, it depends upon all these side effects is based on the human possibilities, that is on the basis of the terms, that is the immune cells, normal cells, and the cancer cells. Usually the pharmacology concept it was discovered that studies the effect of the drugs on the body cells, where they are segregated into 4 points, that is the pharmacokinetics, pharmacodynamics, pharmacotherapies, and the pharmacognosy. Here, the study of these natural plants as well as the effects which is given to the particular patients, that is going to be overcome. Now, the objective about my research is to introduce a controller for controlling the drug doses, and also we are going to estimate the parameters which is given to the particular patient, likewise the drugs which is given to the particular patients. These are pre-processing stage, feature extractions, feature selections, and the prediction stage. That is the input output of the drugs which is given to the human basis. Here, the non-linear error function based extended Kalman filter for to observe the cells, how much amount of cells when we are giving drug to the particular patient, how much amount of cells are going to be dead, how much amount of cells which is hampering due to that drug, that is the immune cells and the normal cells. These are the prediction methods which we have used. The concept, that was the model which was discovered, that is the non-linear error function based extended Kalman filter. Here we represent the control model for the chemotherapy. Here the amount of immune cells, tumor cells, and the normal cells, they are flashing in front of you, because the vivo experiments, when we are going to conclude with respect to the particular concept, that is the chemo, that is quietly difficult. That's why first the practical stage, here we use the model, and then we just tried how the controller will going to work it out. These are the nominal parameters which we have considered, where the fractional of normal cells, tumor, immune cells we have considered. Here the fractional tumor cells killed by the immune cells, tumor cells, immune cells which is killed by the tumor cells, and the all parameters which was considered at the time of the vivo experiment we have observed with respect to the robust controller. Here the proposed nonlinear function extended Kalman filter is also we have considered some parameters, and these parameters are considered with respect to the nominal parameters. Now, the robust control system, it is related to the how the controller will going to control the amount of drugs as it is given to the particular patient. We respect these are having some particular mathematical models where the controller aims towards the state of the system. The state of the systems are relating to the normal, tumor, immune cells, which tracks the corresponding desired values. Likewise, some of the regressor vectors we are going to consider while designing the controller. Here, in order to concern the uncertainty in the particular patient, the model parameters are replaced with the assessed values. These are the trial and error basis. These are the startings of the work. And as per when we are trying to change the parameters, we have faced so many obstacles while designing the parameter or else while designing the controller. The like now function, the methods which we have used to design the controller, that was the like now function which has been chosen in the particular equations to design the controller. Here, the improved Kalman filter under the proposed nonlinear kernel-based error functions have been considered, where the noise factors plays a very vital role, that is the Gaussian noise and the covariance matrix. Again, the steps which we have considered, that was the prediction and the updation state. The predictions, that is nothing but related when we are going to design the controller, what will be the predictions when we are giving drug to the particular patient, and what is the updation state. That thing we have considered. We have mainly focused on the two concepts, that was the prediction concept and the updation concept. The controller model, that is relating to the covariance matrix estimations, where the residual based approach and the innovative based approach have been considered. These are nothing but the impacts of the proposed and the conventional theory in the 3D graphical illusions I have presented, where you can find it out the amount of tumor cells, immune cells, and the normal cells we have considered when drug is injected to the particular patient. These are the methods which are there. These was the proposed method which I have referred it, that is the extended Kalman filter, adaptive extended Kalman filter, and non-linear error function based extended Kalman filter. When we have designed our controller, it was seems to be like that the amount of tumor cells, immune cells, and the normal cells which was hampered by giving the amount of drug to the particular patient, it was the less amount of, in a less time being, the amount of cells was discovered or else it was treated. These are the conversion analysis which we have considered when the conversion analysis while injecting the drug doses and the conversion analysis when we are not injecting the drug doses. These are the predictions and these are the updation state. So we can find it out. The extended Kalman filter, adaptive extended Kalman filter, you can find in front of the screen the color images I have flashed it out, where the immune cells, tumor cells, and the normal cells are being in front of you. When the drug is injected, the body becomes unstable, and due to that, there are some variations. You can find it out in the second graphical structures. These are the unwanted disturbances occurs in a particular body. The overall performance of the proposed control theory, that is the amount of drugs, that was the first concept. The desired values, we have achieved the concept, that is the desired value. We have changes our system in such a way, that means we are trying to move ourselves, the system, towards the desired values. Now you can find it out. What do you mean by desired values? Desired values are nothing but it should be the human, when a drug is given to the particular patient, these values should be considered and it should happens in the particular body. But right now what we used to see, as the particular patient, based on their immune system and the age factors, so at this consider, it is very difficult for us to approach towards the desired values. That's why we were trying to make some methods in such a way, a particular patient, like age wise, when we are giving drug to the particular patient, we will move on towards the desired values. Now again we are considering towards the second concept, that was the improved scaling factor concept. Here the scaling factor which we have considered, it was the starting factor, where the cells which are considered, we are going to estimate normal, tumor, and the immune cells. Here, the covariance error matrix, that is the Kalman filtering techniques, have been re-enhanced, where the residual based improved estimations have been considered, as well as the improved scaling factor is also being considered. As like when we were designing the controller in such a way, we are using different methods, where we have achieved we have to go towards the destination point. That means we have to move towards the desired values. These are the computational scaling factors which is used while designing the controller to give the drug to the particular patients. Again, these are the 3D analysis which we have considered with respect to the model. These are the C and the D figures are related to the controller which we have designed, the non-linear error function based extended Kalman filter, and again the non-linear error function based extended Kalman filter with the improved scaling factors. Again, the conversion analysis, again we have considered again the conversion analysis when injecting the dose. Now here we can conclude towards the part that when extended Kalman filter and the improved scaling factor, when we are comparing towards this part, it was more precisely the amount of cell which was damaged, that is related to the immune cells, it was more precisely, it was safe. Again, the error analysis, we have worked on the error analysis under the chemotherapy drug doses, where we have checked how much amount of errors are going to be flashed. That was nothing but the error which we have seen to be, it was 60, 80 and 20% better than the work which was published in the previous papers. Time analysis, how much amount of time the body used to take it to dissolve, to enhance that drug in a particular cell, and how much amount of cell is going to be destroyed. These are the overall performances with respect to the previous one. The analysis of the, that we can say the error functions which we have obtained with respect to the scaling factor and the improvement factor. The scaling factors and the standard deviations are computed with the demonstrations and decrement of the error values with an increase in the number of instance. That is the most enhanced, that is the critical part which we have focused on the error functions. Again, the adaptive gray wolf optimization concept we have discovered, where we have to re-enhance the system in such a way that the amount of cancer cells to be destroyed in a limited period of time. Again, the system, the scaling factor we have considered the innovation based, and we have considered the solution based concept, where the implementation work is totally depending upon the regularized error function base, where the minimum errors and the sum of the objective functions have been considered. Likewise, the gray wolf optimization concept, that was the more precise work which we have worked in my research, adds that the proposed work was totally focusing towards the cancer cells. Here, the 3D analysis, when we have come across, we can find it out. The three methodologies we have worked, it was mainly precising towards the cancer cell decrement point of view. Again, the conversion analysis, and the conversion analysis when drug is injected toward the particular patients. Again, we have also taken the systematic representative view of error analysis for the particular cells, and the methods, it was better than the previous methods, that was 57, 54, near around of 28, and the 1.3% better than all the methods which we have used. The time analysis functions we have considered. We have also worked on the analysis of the regularities, where the regularization functions respect to the adaptive gray wolf and the gray wolf optimization, that was more precisely that work which was accepted in the cancer cell journal. Now, the overall performances of the entire systems have been considered. With respect to the entire methods, I have mainly focused on the comparative studies, the design methods which we have done, and the methods which was focused. Lastly, we have focused on the optimization concept. Right now, every researcher is focusing on the optimization concept. Here also, we have worked on the model regularized error function based extended Kalman filter with improved scaling factor and uh, particle swarm update concept. Here, the particle swarm updation model results with better estimations and resolve various optimization issues. However, it seems to be a quite mathematical model, but it is very necessary while designing a controller, while designing a machine. These parameters plays a very important role. That's why that this concept is focused on the bird, that is called as the swarm optimization concept. These are the conversion analysis when the optimization concept have been used. All the methods right now we have discovered, we have come to the conclusion that the optimization plays a very topmost role and it overcomes the entire fault, and we have get the output related to the desired output. These are the conversion analysis when cells are injected, when drug is injected to the particular body. The analysis have been the errors which we have considered, that is the error analysis when we have considered some noise levels, some disturbances we have generated in a body, and then we just find it out the error analysis, and the optimization was working on the entire error analysis. The error analysis with the noise levels which we have taken, that was the predictable one. Some 3 to 4 noise levels we have considered, and we just come to know across at every noise level the optimization concept was behaving very precisely. The conversion analysis have been done. Noise levels likewise 0.41, 43, 55 have been considered, and we have received towards the desired output. The overall performance of entire models with respect to the noise levels have been discovered. It have been calculated and implemented in the particular modeling states. Likewise, the performance of the improved state at a particular immune, tumor, and the normal cells behaves in such a way that the chemotherapy effect of for destroying the cell growth matters a lot. The aim of that concept, the research, is to destroy the cell growth without harming the immune cells
Hello,
and
Dr. Raksha.
normal cells.
So,
Yes.
yeah, can you please just like conclude as soon as possible because
Yes,
we're
yes,
running out
ma'am.
of time.
Thank you. Lastly, for cancer nanomedicines, we have worked on the entire clinical research centers, physics, chemistry. We have discovered the entire concept, and I acknowledge to Dr. Hiran Patel sir, my guide, my fellow Pradhan sir, and the Research Center Institute Manavta, and my institute, current institute, MET's League of Colleges, who given me the opportunity to work on this part. Thank you.